The need for air ambulance transport in the region was evident back in the 80s, and what the Department of Public Health smartly did was they instructed all the hospitals to work together to develop a single program so that we didn't have competing programs in the city. Probably the smartest thing they ever did, and so the Boston MedFlight Consortium was developed, which included all the teaching hospitals in the city. Our first transport was in 1985, June of 1985, and over the years we've slowly yet methodically expanded the operation from a single helicopter to what's now a 3-helicopter operation, a fleet of ground ambulances, and a fixed-wing aircraft that does longer range transports in addition to transports that, because of weather, the helicopters can't do. Yeah, when we started, we were based in originally in the old Eastern Airlines terminal at Logan, and then subsequently moved to the city heliport, which was in South Boston. We had 1 helicopter that serviced the entire region. As demand grew for our services, we expanded by adding first another 12-hour shift and then another 24-hour aircraft. In the summer, our volume grows exponentially, particularly on the South Shore, Cape and Islands, for obvious reasons. And so back in the early 90s, so almost 10 years into the program, we decided to relocate one of our aircraft down in the Plymouth area because it would be much closer to respond to calls for need, both at Cape Cod Hospital and the area hospitals and Jordan Hospital at the time, as well as patients needing our resources on the islands. So we don't just send the helicopter just because we have it. We have 3 resources in all of eastern Massachusetts, and we want to make sure that our patients get the right vehicle for that transport. The ground ambulances have the same crew, they have the same training, we have the same equipment, you're getting the same high quality care and safe transport. You just don't need to be there in minutes.
Boston MedFlight's Communications Center is the 911 center for all of Boston MedFlight. We take all the first incoming calls, and it could be anything that may need a helicopter, a plane, or our critical care ambulances. They have to then sort that out as they take in the information. They cross-reference it both verbally as well as what the CAD or the computer-aided dispatch system says, and then they make the proper assignment to the proper vehicle, whether, again, it's providing the ground ETA, helicopter ETA, or the plane ETA. They then continue to collect all the information together using different weather, different ETA sources that give us the ability to have live traffic in it so that we can give real accurate ground ETAs for all of our ambulances. I think the biggest thing for our communication center is, in a lot of ways, they act like a mini air traffic control center by all of the information that they're processing. Whether it's other helicopters within the Northeast Air Alliance that is coming in and out of Boston. So it's probably a lot of the unknowns that we do on a daily basis, whether it's checking on the aircraft when they land somewhere. If we didn't get a radio call, we're immediately making phone calls, as well as dealing with just helping out people that call us that might not even need our services. We want to be a one-stop shopping for unit phone numbers, hospitals, or other maybe fixed-wing programs in other parts of the country that can assist someone that we can't.
We are a 501c3 public charity. We are a licensed ambulance, and we transport patients regardless of their ability to pay. That goes back to having a solid core consortium that helps bottom line our deficit. To do what we do at the level that we do it, with a huge focus on the high quality care and safety above all, you don't make money doing this. So it needs a tremendous amount of support, and we have that from our consortium institutions. We have people donate often, and they can look for information on our website at www.bostonmedflight.org or call our offices. We do a lot of fundraising events. We have a golf tournament coming up in August that we do annually. And we do a fair amount of outreach, not focused on fundraising, but for instance, we recently did had our annual patient reunion where we had 400 people visit us here at the airport, and in a little bit of a carnival type atmosphere, because the last time they encountered Boston MedFlight was probably on the worst day of their lives. And so it's a chance for us to reconnect with our patients, to help answer some of their questions, to have them answer some of our questions, and be able to provide some closure on what was typically a bad experience for them. 90 of those patients were children. So when I say carnival, it was like a carnival going on with base painting and balloons and dancing and prizes. But we wanted them to have a day where they could say they felt good when they heard the word Boston MedFlight.
Med 3, I have Beth Israel Plymouth requesting in their ER undesignated Boston.